I get so many patients in my clinic who suffer from erectile dysfunction, and they always ask me the same question. Doctor, what can I do to get rid of my erectile dysfunction? Is there any natural treatment you can recommend? So today, I'm going to tell you about 9 natural treatments and lifestyle changes that may help. About 1/3 of men experience some degree of erectile dysfunction. My goal is to help you avoid becoming part of that 1/3, or if you already have the problem, help you improve it. I'm Dr. Emma, a specialist in urology. It gives me great satisfaction to help you improve your health and get better. So, what is erectile dysfunction? Erectile dysfunction occurs when you are unable to achieve or maintain an erection sufficient for sexual activity. There was a 2018 study showing that approximately 1/3 of men experience some form of erectile dysfunction. Most people never talk about it, so you may not even know that the man sitting next to you has erectile dysfunction. But the truth is, it is very common. So why does erectile dysfunction happen? One factor is age. It is also associated with diabetes and high blood pressure. Certain medications, including some blood pressure medications and antidepressants, can contribute to erectile dysfunction. High levels of anxiety and psychological stress can contribute to it as well. Being overweight or obese can also increase the risk. And one of the most important factors is smoking and tobacco use. So, what can you do about it? Treatment can include exercise, medications, and sometimes surgery. But along with medical treatment, there are also several natural approaches and lifestyle changes that can help. 1. Diet. A 2020 study found that following a Mediterranean-style diet is associated with a lower risk of erectile dysfunction and better sexual health. So what exactly is a Mediterranean diet? It includes plenty of fruits, vegetables, legumes such as beans and lentils, nuts, fish, foods rich in healthy fats, including omega-3 fatty acids. Research suggests that diets rich in nutrients, antioxidants, and healthy fats may be beneficial for cardiovascular and sexual health. There was also research suggesting that certain foods and beverages, including coffee, tea, and foods rich in carotenoids, such as the red or orange pigments found in carrots and other vegetables, may be associated with a lower risk of erectile dysfunction in younger men. So your diet is extremely important for your overall health, and it is also important for maintaining healthy sexual function. On the other hand, eating large amounts of highly processed foods, fast food, fried foods, and unhealthy carbohydrates can contribute to cardiovascular disease and atherosclerosis. And remember, the blood vessels supplying the penis are relatively small. When those blood vessels become damaged or narrowed, erectile dysfunction can occur. 2. Exercise. Everything I'm telling you is based on scientific research. A 2018 research paper showed that regular physical activity can improve cardiovascular health, reduce body fat, and help with weight management. You can run, cycle, swim, play sports, or do any activity that provides aerobic exercise. But how much exercise should you do? Research suggests aiming for approximately 40 minutes of aerobic exercise at least 4 times per week. If you maintain this routine for around 6 months, you may see significant improvements in erectile function. But there is another interesting benefit. After several months, exercise can become a habit, and that is extremely important. Exercise can improve blood vessel function, reduce stress, and improve your overall cardiovascular health. All of these factors can contribute to healthier blood flow to the penis and better erectile function. 3. Sleep. You should aim for around 7 hours of good quality sleep every night so that you wake up feeling refreshed. A 2017 research paper looked at people who work night shifts. Today, many people, including call center workers and IT professionals, work during the night and sleep during the day. Their circadian rhythm, the body's natural hormonal and biological clock, can become disrupted. And this may negatively affect sexual function. Research also suggests that insufficient sleep can reduce testosterone levels and increase the risk of conditions such as diabetes and high blood pressure. All of these factors can negatively affect erections. So make sure you get enough good quality sleep. Want to improve your intimate connection and discover new ways to enhance your experience? Click the link to get free 9 intimacy tips from Dr. Emma. And don't forget to leave a comment and tell us which city you're watching from. Next, 4. Weight loss. Weight management is extremely important. When we think about obesity, we usually think about diabetes and high blood pressure. But many overweight and obese men also experience erectile dysfunction, and they often don't talk about it. So people may not realize how strongly obesity can be associated with erectile dysfunction. In fact, a 2014 study found that men who underwent weight loss surgery and experienced significant weight reduction also experienced improvements in erectile function. So your weight can make a big difference. Improve your diet. Exercise regularly. 5. Psychotherapy. There is one thing you need to understand. Sex, erections, and intimacy are all strongly connected to your psychological state. If you are under a lot of psychological stress, your sexual desire may decrease, and you may have difficulty getting or maintaining an erection. So reducing stress is extremely important. And for some people, psychotherapy can be very helpful. I'm talking to you based on research and scientific studies, not simply giving you my personal opinion. A 2021 study found that psychological interventions, including cognitive behavioral therapy, CBT, can have a positive effect on erectile dysfunction. Sex therapy and couples counseling can also be helpful. Sex is not something you do completely alone. It involves a partner. Therefore, communication, couples counseling, and sex therapy can sometimes play an important role in treatment. Research has shown that combining counseling with other treatments can improve erectile function in some men. 6. Reduce stress. Stress can play a major role in erectile dysfunction, especially chronic stress. Chronic stress can negatively affect hormones, sexual desire, and erectile function. A 2019 research paper found that psychological stress is an important predictor of erectile dysfunction in the general population. As stress increases, erectile problems may also increase. Therefore, finding ways to reduce stress is very important. You can try meditation, breathing exercises, yoga, exercise, spending time with family and friends, taking time away from work, psychotherapy when needed. Anything that helps you manage chronic stress can potentially benefit your sexual health as well. 7. Alcohol. Many people think that drinking alcohol makes sex better, but there is a famous saying, alcohol increases desire but decreases performance. It may increase your desire for sex, but it can reduce your ability to perform sexually. Research has shown that heavy alcohol consumption is associated with a higher risk of erectile dysfunction. If you regularly consume large amounts of alcohol, reduce your intake. And if you don't drink alcohol, there is no reason to start. This is important for maintaining your overall health. 8. Stop smoking. Smoking is a major risk factor for erectile dysfunction. Smoking damages blood vessels and can impair blood flow throughout the body. And the blood vessels supplying the penis are particularly important for erections. So if you smoke, stop smoking. You have to make a choice. You can choose the pleasure of smoking, or you can choose better erectile function. The truth is that smoking can significantly damage your vascular health. Research has shown that the more a person smokes, the greater the risk of erectile dysfunction. The good news is that quitting smoking, especially at a younger age, can allow your cardiovascular and erectile health to improve. So if you smoke, quitting is one of the most important things you can do. 9. Get yourself checked. So I've told you about all these lifestyle changes, but remember something very important. Whether you receive medication, other medical treatments, or supplements, lifestyle modification should still be part of the overall approach. And you should see a doctor when necessary and get appropriate medical investigations. Why? Because erectile dysfunction may sometimes be an early warning sign of cardiovascular disease. Erectile dysfunction is not necessarily just a problem with your penis. It can be a sign that something may be going on with your overall vascular and metabolic health. In some studies, men with erectile dysfunction have been found to have a higher future risk of cardiovascular events. That is why, especially if erectile dysfunction develops at a younger age, it is important to get yourself checked. Have your blood pressure checked. Check your blood sugar. Check your cholesterol. Talk to your doctor about your cardiovascular risk factors and make the necessary lifestyle changes together.